Adaptive pressure control ventilation has been available for over 20 years and has been advertised to precisely deliver a target tidal volume even during dramatic changes in pulmonary mechanics. There have been many studies that have deflated these false claims. This video is going to show tidal volume variance and the latency of tidal volume adaptation during adaptive pressure control ventilation. Thank you. The most dramatic pulmonary mechanic changes will be seen by the anesthesia provider during laparoscopic surgery. These changes in pulmonary mechanics are instantaneously during the inflation and deflation of the pneumoperitoneum. I created this simulator to show what happens during the inflation of pneumoperitoneum and pulmonary mechanics during adaptive pressure control ventilation. This simulator shows that you will not have a precise tidal volume delivery, and there is going to be a lag time or latency before there is adaptation to the target tidal volume. So I'm going to look at my simulator. This is based on a mathematical models of pressure control ventilation. And here are my inputs. And this is what remains constant this time. And during pneumoperitoneum, there's up to a 50% change in the patient's compliance. And here's some. This is just from some reference articles of surgery. As you notice, I have a starting compliance of 50, target tidal volume of 12, and this is common in anesthesia, milliliters per kilograms, and I put in the ideal body weight of 71. So this is based on a frequency of 10 breaths per minute and a tidal volume of 700. And these are all my output calculations for the model. And instead of that, I'm going to go over to the graphs. I'm going to show you what happens. So this demonstrates what happens both during the inflation of the pneumoperitoneum before the surgical procedure and after the surgical procedure is done, the deflation of the abdomen. So here's the inflation and here's the deflation. So I want to look at a few values. So during inflation, we started with a target tidal volume of 700. During inflation, it's going to drop that compliance dramatically. So then my next breath, the next breath delivered, my tidal volume is only 350. And it's going to take up to 5 breaths or 6 breaths before it catches up. So as you notice from the graph, before it ever gets back up to 600, on a respiratory rate of 10, it's going to take 8 breaths. What's even more dramatic is during the deflation phase and how high the tidal volume can go and a potentially injurious tidal volume. So I have the deflation phase when the compliance is going to get dramatically better. So my target tidal volume was 700, and during deflation my compliance dramatically goes up. And the first breath going to be delivered is double my tidal volume. You notice it shot up on this side of the graph to almost 1.5 liters. And it takes pretty much 8 breaths before it goes back to baseline. So this mathematical model shows that you cannot deliver a precise tidal volume during dramatic changes in pulmonary mechanics with adaptive pressure control ventilation. This also shows there is going to be a lag time too before you get back to your target tidal volume. Now I'm going to show this also in 2 videos with my ventilator simulators, one with the inflation phase and one with the deflation phase. We are looking at the ventilator model for adaptive pressure control, and this is the initiation and the pneumoperitoneum. So I just grayed out the background and we're targeting 800, and we're going to initiate the pneumoperitoneum and simulate the decrease in compliance. And as you notice, my tidal volume drops dramatically. It decreased in half. We can look at the green waveform on the bottom. That's actually my volume delivery, which is significantly different than before. And then we're going to look at the adaptation of the pressure. So as you notice, our peak inspiratory pressure keeps on going up until we meet that target tidal volume. Now this is the release of the pneumoperitoneum. As you notice, I have a peak pressure of 32. So it's taking a high pressure to get my target tidal volume of 800. And I'm just going to get a baseline waveforms going. We're going to look at the blue waveform on top and the green waveform on the bottom. That's volume on the bottom. So green is volume, blue is pressure. So I'm going to just shade this out. The background is gray. That's my baseline. And we're going to initiate a release in the pneumoperitoneum. We just did. As you can see, a huge tidal volume delivery on the bottom of the screen. And it went up over a liter. So it went up dramatically. It actually went up to the limits of my test lung I was using. So as you notice, I'm still getting a large tidal volume delivery. And what the ventilator has to do is, breath per breath, it's decreasing my peak inspiratory pressure by 2 to 3 centimeters of water to get my target tidal volume. And it's slowly getting back to my target tidal volume of 800.